Kelly Garster, and today I'm going to talk to you about how alternative medicine can save your life. Prescription drug overdose caused more deaths than motor vehicle crashes. Drug overdose was the leading cause of injury death in 2013. Prescription drugs are a growing deadly epidemic. They are far too easily accessible and all too often overprescribed. There is an alternative to prescription drugs that can save your life. According to the Center of Disease Control, 43,982 drug overdose deaths happened in 2013 in the United States. 22,767 of those were related to prescription drugs. And these were people ranging in the ages as young as 12 up to the age of 64 years old. With that being said, for every one death, there are 10 admissions for abuse, 32 emergency room visits, 130 who are abusing them and becoming dependent on prescription drugs, and of those, 825 are non-medical users. There are several risk factors involved in becoming addicted to prescription drugs. The first one is doctors prescribing overlapping prescriptions. A lot of times, doctors are not checking charts properly or collaborating with the other physicians to see what scripts that they might have the patient on. The second one would be taking higher than prescribed dose. Let's face it, we've all taken an extra Advil or a little extra cough syrup, but there is a reason for those recommended dosage. The third is having a mental illness or a history of substance abuse. Again, the doctors need to make sure that they are thoroughly checking the charts, and when they interview the patient, making sure that they're asking the right questions. The fourth is living in a rural area with lower income on Medicaid. Studies show that doctors prescribe Medicaid patients 2 times the amount of painkillers as non-Medicaid patients. And of those Medicaid patients, they are 6 times more likely to become addicted to painkillers. A study done by Washington State University in 2010 showed that 45% of prescription drug overdose deaths were people who were on Medicaid. The solution is alternative medicine. An estimated 90% of people with chronic pain are prescribed painkillers, and most don't find relief. Another study was done by Washington State University in 2010 with 1,000 people being treated for chronic pain. Of those 1,000 people, most people reported that during their treatment and after their treatment, they still experienced severe pain in their daily activities, even after taking the painkillers. This is because they were not treating the underlying problem. They were just trying to mask the pain. The reason that people have pain, most likely, and are prescribed painkillers is because of back injuries or neck injuries. So let's talk a little bit about the basic anatomy of what causes these injuries. This is our spine. The spine is surrounded by several muscles that support the spine and make the spine more flexible and stand erect. These are the vertebrae, which are circular bones that make up the spine. Down here would be called the lumbar section. We have the thoracic, and then up in the neck is the cervical section. In between each of these vertebrae are gel-like sacs called discs. They act as our shock absorbers. When one of these is subluxated, meaning that it's bulging or slipped, it will come out of the vertebrae, which will cause bone-on-bone friction and can cause extreme pain. In between all the vertebrae, there's a little hole in there, and it goes all the way down, and that's the spinal cord. The spinal cord houses the nerves that take messages from the brain to the rest of the body. When there is pressure put on the spinal cord, that's when we get our shocking or burning pain, which most people will then come in and get prescribed painkillers. The problem is that it is not fixing the problem, it's just masking the pain. Well, what can we do about this? According to the National Institute for Healthcare and Excellence, or NICE, they recommend several things. The first would be a structured exercise program. Most structured exercise programs are done by physical therapists. They use aerobic, strengthening, and stretching exercises over a course of 8 to 12 weeks. Usually the patient is recommended to come in 3 times a week and do the exercises at home on their own in between visits. The second would be manual therapy. Manual therapy can be done by a chiropractor and or a massage therapist. The massage therapist will work on relaxing the muscles so that the spine can become more flexible, whereas the chiropractor will treat the subluxation and help put the structure back into alignment, causing the vertebrae to take pressure off of the disc and not causing that pain anymore. There are also other forms such as yoga, acupuncture, essential oils, herbal supplements, meditation, and there's even counseling for chronic pain. There's a reason that we use alternative medicine. First of all, it's almost impossible to overdose on. Could you imagine having too much massage? And there's also little to no side effects with alternative medicine. More than 2/3 of people who have tried one of these approaches have reported their conditions to improve in overall health and has made them feel better. Not only do these programs help them feel better, but when you get a chiropractic adjustment or massage, it does help relieve toxins of your body, which cleans out other systems in your body and gives your whole body an overall feeling of well-being and relieves stress. Our bodies are designed to heal. As the wise Hippocrates once said, the chief role of the physician is to aid in the natural resistance of the body to overcome metabolic imbalances and restore health and harmony to the organism. He placed a great emphasis on strengthening and building the body's inherent resistance to disease. Alternative medicine has been around for thousands of years, and many cultures have contributed to it and still practice it with great success today. So before you fill your next script, think twice. Alternative medicine could save your life.